Okay, everybody, we have reached the bottom of the hour, so let's get started with today's L10 webinar, Improving Your Vision for Business Acumen 2020, sponsored by CMR Institute. My name is Tim Sosby. I'm Editorial Director for L10. It's my pleasure to welcome you today and serve as a host of our webinar. And today, that hosting job means I get to get out of the way and let the professionals take over here for you today. I'm going to, joking there, but I'm going to quickly turn things over to our folks from our speakers from CMR Institute today. They're going to tell you more about today's program and get things started for us. In the meantime, I will tell you to draw your attention to the control panel there on the right side of your screen. I especially wanted to point out the questions window. If you look at that questions window, that's where you'll be able to type in any questions or comments you have for our speakers today. And you'll also be prompted at one point to share your thoughts through that questions window. So it's good to know where that is on your control panel. And I also wanted to point out quickly the handouts window. There are some handouts in there you may wish to download. We have some L10 information on our upcoming 2020 conference, our 2020 calendar of events, and also information on the call for entries for the L10 Excellence Awards happening right now. So you can download any or all of those if you like. There's also 2 documents in there from CMR Institute that'll provide some content to go along with today's webinar content, and they'll tell you more about those documents, but you're going to want to make sure you download those. You can download any of these documents by highlighting the title, and it will walk you through how to download to your desktop. And if you have any questions about any of that or any issues with any of that, we can always connect you those handouts as needed. So thank you for your joining us today. We look forward to sharing the webinar with you. I'm going to go ahead and turn things over to Michelle O'Connor, President and CEO of CMR Institute, who's going to take it from here and tell you more about today's program. Michelle, thanks for joining us.
Thank you so much, Tim. I appreciate it. So welcome, everyone, to today's webinar, where we'll be discussing 5 trends in the healthcare landscape for 2020 and what they mean for business acumen training. As Tim said, I'm Michelle O'Connor, President and CEO of CMR Institute, and I'm honored to be here today with Eimear Kivlighn. Eimear currently leads the Business of Oncology training curriculum across all customer teams and headquarter functions within the Oncology Business Unit at AstraZeneca. Over the past 2 years, she's built out a comprehensive curriculum covering all aspects of the oncology landscape, from distribution and payment models to oncology practice and emerging trends. Welcome, Eimear.
Thank you, Michelle. I'm delighted to join you here today.
Right. So we've all been there, right? You're standing in front of a person who could make or break you. Maybe you're nervous or maybe you're confident. They ask a question, but can you give an accurate response? Your heart races just a bit. Suddenly and hopefully the answer comes into focus. What I just described could be a vision test at the eye doctor or a sales call with a customer. That's because the visual acuity and business acumen are actually quite similar. One is literally the sharpness of your vision, measured by your ability to identify numbers from a chart. The other is the keenness of your business knowledge, assessed by the quickness and accuracy with which you make quality business decisions. So having sharp vision is critically important to all that we do. And in the world of modern healthcare, customers expect today's sales representatives to be sharp and focused when it comes to understanding their daily challenges. Having a fuzzy vision for business acumen just isn't an option. So looking ahead to this new year, one thing is clear. Life science companies will need 2020 vision to focus on the trends that will affect their customers. Today, we're going to take a closer look at 5 trends that we see out over the healthcare landscape for 2020 and what they mean for business acumen training. But before we do, we want to know how your vision is. That is, how is your vision for business acumen at your company? So which picture best describes your company's current business acumen training strategy? So type in A, B, C, or D in the question window as it best describes you. So type A if you have 2020, perfect vision. You have all the right content focused on the appropriate roles. Type B if you have glaucoma. You have content focused on business acumen, but everyone gets the same content. Type C if you have macular degeneration. You have some business acumen content, but your learners aren't seeing everything they need to. And type D if you have cataracts. Strategy? What strategy? It's all a blur. So let's see what types of vision that we have coming in. Right. Looks like we have a little bit of everything. So does that surprise you, Eimear? We're kind of all over the map.
No, it doesn't, and I'm hoping that when I have a chance to respond to some of your questions today, that the folks who have taken the time to join us today will see that it really is a journey and moving from cataracts to 20/20 vision. So I'm not surprised. I think many companies are in various points of the business acumen journey, but it's helpful to see the information come in.
Agree. Thank you. All right, so let's get started. So our first healthcare trend for 2020 is the continued focus on delivering greater value. So value-based care is here to stay, even if the transition away from fee-for-service has been somewhat slower than what was originally expected. So today, slightly more than half of all payments made to providers are tied to clinical or financial performance. That means there's more pressure to deliver products and services that can reduce costs and improve outcomes. So how can business acumen training help prepare your sales teams for this trend? So to succeed, sales forces should understand the different ways that government and commercial health plans measure their customers' performance. And no matter who their customers are, whether it's physicians or hospitals, ACOs or health plans, sales professionals need to position their products and resources so that they are seen as solutions to improve their customers' performance. And to help sales professionals understand their customers' challenges, training on topics like value-based care or bundled payments, cost containment strategies, quality measures, and the business of healthcare is essential, although the content should be tailored to each customer-facing role. And finally, sales professionals, especially those working with key accounts, need to be confident in their understanding of health economics and outcomes research so that they can refer to appropriate data during value-based discussions with customers. So, Eimear, how do you make sure that different roles within your sales force can talk confidently about value-based care? And how do you tailor the training based on different customer-facing roles?
So thank you, Michelle. And again, thank you for having me here today to share the business acumen training, or the business of oncology curriculum as it's known here within the training department at AstraZeneca. So let me start by saying that this really is a journey, and we are continuing to work towards that 20/20 perfect vision, really trying to align the right content towards the appropriate roles. Before I go any further into kind of the roles within AstraZeneca and how we are aligning the content, so what it means for us in the world of oncology when we talk about value, it's really focused on the pilots that are coming out from CMS, as CMS is shifting away from volume and shifting to value, and most specifically the oncology care model. So we really need to understand across the different roles what the oncology care model means for our providers and our accounts. So what we have done, because there are approximately the 11 or 12 different roles that we have, field-facing roles, we have developed roadmaps that are aligned to the specific roles within the organization. So they are role-specific roadmaps. So if you're in the commercial side of the organization, you're going to have access to and visibility to the commercial roadmap for the business acumen curriculum. The same thing for medical, if you're in a medical-focused role, and then in non-commercial, so like a market access role, there would be a different version of the roadmap aligned to the level of content that you would need in order to be that credible, reliable contact for the customer. So that's where we are up to 2019. Now in 2020, I'm going to take that one step further, and I'll be looking to develop a level-based roadmap. So looking to develop a foundational level roadmap, an intermediate level roadmap, and an advanced level roadmap to help people navigate the curriculum, again, that's role specific for them.
Wow, that's fabulous. It really sounds like you have targeted training for every role. That's great. Okay, so moving along to our second trend is ongoing political debates concerning prices, Obamacare, and other hot topics. So in recent months, we've seen a number of drug pricing bills emerge from Congress, And legislative efforts to curb drug prices will likely continue into 2020, especially as the election heats up. But for now, the ACA remains the law of the land, but its fate is uncertain and could once again be in the hands of the Supreme Court later this year. And hospitals are being called upon to make the prices that they negotiate with health plans public. Although that is scheduled to begin in 2021, the issue is being challenged in court this year, so it could come up. And then finally, another hot topic that we'll certainly hear more about on the political front is the idea of expanding coverage, such as through a Medicare for All type plan. So how can business acumen training prepare your sales team for this trend? So as drug prices face ongoing scrutiny, sales forces need to know how to respond to their customers' price concerns, and they also need to know how to effectively discuss the value of pharmaceuticals and their products. So to do so, they really need to possess strong, active listening skills as part of their business acumen. And through this, they can find opportunities to talk about, for example, potential solutions their company may have that can help lower patients' cost-sharing burden and promote better adherence and better value. Secondly, sales forces need to understand the basic tenets of healthcare reform so that they have some context as reform efforts continue to evolve. This will help them comprehend the implications of political events in 2020, including potentially further dismantling of the ACA on their customers. So the bottom line, sales professionals at every level should be able to understand the alphabet soup of acronyms that their customers are keeping up with, like changes to the ACA, MACRA, 340B, and others. So legislative and regulatory news can change the landscape from week to week. Eimear, how do you make sure that your sales team stays informed without overwhelming them? And why is this type of knowledge important to improve or maintain market access?
So to your point about it changing so quickly, everything that is coming out of DC changes so rapidly that I found one of the most effective ways to keep the teams informed is through podcasts. So podcasts, they're quick to develop, easy to access for the learner, and they're efficient in terms of really honing in on the most important elements that are coming out of DC that the learner would need to know. Now, in developing the podcast, I've actually used both internal experts within the organization as well as external experts to develop them. And that not only helps them be cost effective, but it also provides a perspective that we may want to provide our learners on some of the key policy topics. The other thing is the policy podcasts are available to suit the different learner needs. So again, trying to stay focused on the different level that is necessary for different roles. One track is what I call my emerging and future podcast series. So that is more focused on the market access and those groups who are really having the C and D suite level conversations. And then the other I refer to as my marketplace dynamics podcast. And that's helping to keep the rest of the field sales organization updated on what may be happening with the for example, OCM, what may be happening with ACA, etc. That is currently where we are right now in 2019. In 2020, to your point, a lot will go on. I am going to be working and collaborating closely with the policy area to develop a series of what I'm referring to as policy podcasts to really try and stay very, very close to all of the changes that we know we're all going to see coming in this election year.
Wow, that's pretty impressive, Eimear. Thank you.
Thank you.
So our third healthcare trend for 2020 is a push towards greater consumerism, as traditional healthcare providers like hospitals face competition from new entrants into the industry. So consumerism is all about making the delivery of health services more responsive and convenient. And those are two words that aren't often associated with healthcare, as we all know. So this trend is why your traditional customers, namely physician groups and hospitals, are seeing more competition from telemedicine apps or retail clinics like those in CVS or Walmart, for example. So business acumen can help prepare our sales team for this trend as well. So for example, understanding market dynamics is essential for anyone who works in the field, but For those who work with key accounts, they need an especially sophisticated skill set to assist their traditional customers who are being disrupted by these new market entrants. And completing a SWOT analysis as part of their business planning toolkit can really help account teams set their strategy and determine which solutions to pose to customers that are facing disruptions. And finally, the ability to maintain a customer focus and use it to advance business strategy is another advanced skill that account teams will need to leverage in 2020. So consumerism and other trends are, as I mentioned, continually disrupting our customers' business and can take a lot of bandwidth to follow. Eimear, can you tell us what you're doing to keep your sales professionals up to date on what matters most?
Yeah, so as you just mentioned, there's a lot, and it can take significant bandwidth to just stay abreast of what is going on, and then you've got the challenge of also trying to stay at the forefront of it. So in order to identify what matters most, we actually conduct surveys. So we have an external survey that was conducted late in 2018 that really helped craft our focus for 2019. And in that external customer survey, we really identified a need for an additional deeper dive for the curriculum. And the gap that we identified was to continue to increase competency around the organized customers. So as we look at IDNs and health systems, all the shifts that have occurred in that space, we realized that there was a gap in knowledge as our field-facing teams were showing up to that customer and really needed to have a better perspective of their clinical, their operational, and their business perspective. So we formed a cross-functional team internally, worked diligently last year to develop a specific curriculum to address the need, and then rolled that curriculum out. And we were targeted in our timing of rolling the curriculum out in the fourth quarter with the support of senior leaders to really encourage conversations during the IDP time of the year, end of the year, around engaging with the curriculum based on the individual needs of that learner and what the market dictated, because not every market is the same, obviously. So we conducted the external survey to identify that gap. And then internally, I have an ongoing advisory board that I have formed to really stay close again to the teams to see what it is that they need additional information on, or maybe a deeper dive on. In 2020, I will be continuing to gather input from external and internal. And then one other thing that I do on an ongoing basis, I attend the key business conferences to hear what is coming out from the main stage and what's happening at the keynotes, because that really does tell me what's not happening, what above and beyond what's happening now, but what really is at the forefront of our customers' minds.
That's great. That firsthand perspective is really important. So, okay, thank you. Let's move on to our fourth healthcare trend for 2020, which is greater calls for health equity in population health efforts. So, for several years now, healthcare providers have engaged in population health management through a variety of different models, like patient-centered medical homes and ACOs, as well as through less structured strategies. In 2020, we expect to see an even greater push for health equity as part of these initiatives. So health equity means that certain groups are not disadvantaged when it comes to achieving the best possible health outcomes. In other words, everyone has access to the highest quality care. And the goal here is really to eliminate longstanding health disparities that have occurred among groups like African Americans, rural Americans, the poor, and the LGBTQ community. So Business Acumen can help your sales force respond to this trend as well. So in 2020, knowledge about population health and health disparities can help your sales force, especially those at the account manager level, uncover potential partnering opportunities with their customers, as one example. And your sales professionals really should understand their customers' mix. So that means the percentage of patients who may be covered by Medicare, Medicaid, or commercial health plans, really important. So population health is an important trend really for all customer-facing roles to understand so they can better serve their customers. But Eimear, can you speak to how you train your team on population health and if you tailor the training by sales role?
Yeah, so our approach really is, it's really threefold. So I think about the new hire training, what are we going to do for current enroll, and then what about all the other individuals who have joined the organization over the last couple of years, who may be relatively new to oncology, but have joined the oncology area within AstraZeneca. What are we doing to help to support those individuals too? So for new hire training, we provide the background that they need on population health and what it means in the world of oncology, both in home study, so they do get pre-read material that they need to have reviewed prior to showing up to live training. And then when they come into live training, we do a deeper dive on, again, what population health means to the oncology world. And this is actually one of the areas where I do spend some time working through many of the acronyms that are out there to try and help level set and take some confusion out of the environment. For those who are in role, we continue that conversation both through the individual development plan discussions that I mentioned a moment ago, but also I try to pulse out content on a regular basis. So every month, I have tried to make use of all of the communication tools that are available to me internally, and I work with those teams to include something that is relative to the business of oncology. In this case, it could be population health, to teams, so that we're trying to keep it in front of them as an ongoing additional support to help them in their conversations with customers. So that is then the IDP, ongoing deployment, and pulsing out of content. The Headquarter Foundations is a class that I started last year, kind of in a pilot mode, just to see how well it was received. And so it's for those folks who have come into headquarters. It's called Headquarter Foundations because it is a foundational program that is available to individuals who are new to oncology. And during that time, they would also get an orientation to what population health means for oncology. That program is going to expand. This is kind of 2020. We are going to expand the program in 2020 based on demand.
Great, great. Again, doing a lot in that particular area. Thank you.
Yes.
So our fifth and final trend for 2020 is more technology and innovation that's influencing healthcare delivery. So just like every other industry, healthcare is being transformed and in some cases disrupted by technology and innovation. And in 2020, we're going to hear more about how digital health and artificial intelligence, machine learning, regenerative medicine, telemedicine, and other innovations are changing healthcare. Business acumen training plays a role in this final trend. So I think it's important to consider is, for example, is change management a skill that your sales team possesses? And if not, it might be time to look at training that can help them stay agile. This type of agility, isn't innate. It can be trained. And for managers, this skill is especially important as their ability to adapt to change directly influences others. And finally, to adapt to technology-driven change, sales forces also really need to have a good working knowledge of health information technology and how their customers are using EHRs to deliver effective care. So, Eimear, there's so much disruption going on in healthcare. How do you make sure that your sales force keeps up on the innovations and technology developments that are having really the greatest impact on their customers and on patients?
Yeah, so interoperability and technology has really had an impact in the world of oncology, and it was one of those areas that we identified as being really important for the field-facing teams to have a good grasp of. So it's not just, what is an EHR and how is an EHR different from an EMR, but really how is interoperability and HIT affecting how our products are making their way through systems to eventually to the patient. It's way beyond just getting a product on formulary anymore. You really need to understand at a community practice level or at an institution level, what is the role that clinical pathways, care plans, and basically the EHR system is having having in ultimately allowing the physician to be able to choose your product that is right for the patient. Above and beyond that, then it's understanding the stakeholders, right, that are important through that entire approval process. So because of that, that was one of the areas in the curriculum that we made a strategic decision to do a deeper dive, and we are now extending that to an even deeper dive in workshops that we will be doing to show again the functionality of the EHR and how an oncologist is interacting with it and ultimately what it means for patient access. In 2020, I know you mentioned AI. This is an area that again is really popping, and as I really scan what's coming across the newswire, as I keep a close eye, and as I said, conferences that are focused on the business of oncology, this is an area that's been bubbling for a while, and now it's showing up on the keynote speakers across the conferences that have already been announced for 2020. And so that is an area of focus for me this year to see, again, working with the teams internally, is this something they would like additional information on? And so we'll build something out to support AI.
Okay, fantastic. A lot going on. We've got just a few minutes left here for questions, and that was really a lot of information. I did want to take one question from the audience, at least here, Eimear, if that's okay. The
Sure.
question is,
yes, absolutely.
Yes, if you're doing audio or video or just podcast, is there any video or is it primarily podcast?
Very good question. It's actually a mixture of both. So we've been playing around with different technologies and different platforms. We started off just with the podcast, and now we have started to incorporate video and slides above and beyond that. So we're trying to, again, make the experience that the learner has beyond just the listening mode. They can just do the listening mode, but there is more available to them if they have the option to do that.
Okay, great. Well, we've just about come to the end of our time, and I wanted just to, first off, Eimear, thank you so much for participating today and providing such great information. It's been extremely helpful and informative and very, very interesting.
Well, thank you, Michelle, for having me. As I said, it's really been a journey. There's never a dull moment, I will say, in this area of business acumen. There's a lot of learning to be had, and I'm seeing more and more engagement as time goes on among all field-facing teams around it, as people understand that in order for us to be credible to our customers and continue to gain that market access, that showing up to the customer, having an understanding of their business is really critical. So it's why we continue to, try and get to that 2020 vision that you spoke about at the beginning of the program.
So true and so important. So thank you. I also wanted to mention that we've got 2 handouts available for download, depending on where you are in your business acumen planning. I think that both of those handouts will help you. And we also know that there was a few questions we didn't get to, so we hope we can, we'll follow back up with those questions. And I think finally I wanted to turn it back over to Tim for any last minute follow-up. Tim?
Yes, thank you, Michelle, and thank you, Eimear. A great presentation. Everybody, thanks for joining us today and for participating throughout today's program. Michelle mentioned the handouts window. Again, I wanted to make sure I point that out to you. There are the 2 items there from CMR, and there are several items from L10 you might wish to download as well, including a copy of our call for entries, or some information on the call for entries for the 6th annual L10 Excellence Awards. We're taking entries through February 10th, I believe is the date, and the awards will be given out at the annual conference this June in Kissimmee, Florida. There's also information about that annual conference, and we also have some information on the 2020 L10 calendar of events. They'll give you some idea of what's coming up and hopefully what's coming up near you, including mixers. So certainly look for those. You can also find out more information, of course, by visiting the L10 website. So that's it for today. I'm going to go ahead and close this out. Everybody, thank you for joining us. Let me thank our speakers again, Eimear Kivlighn. Eimear, thank you very much for joining us. And Michelle O'Connor from CMR.
Thank you,
you both.
Thank you.
And everybody, thank you everybody for joining us as well and participating throughout today's program. And we look forward to seeing you back here for the next L10 webinar. Bye-bye, everybody.
Bye.